Hello, my name is Tracy Trypuc. Welcome to Your Health Matters. Today we'll be discussing several important health topics, including substance abuse on Long Island, liquid nicotine, and youth sports safety. And now I'd like to welcome my guest, Legislator Sarah Anker from the 6th District in Suffolk County. Sarah, welcome back.
Hi, Tracy.
Hi. Last time you were here, we discussed bullying awareness. Can you briefly discuss how that campaign is going in the county?
Sure. So when I became aware that bullying is incredibly invasive in our school system, especially cyberbullying, I worked with the county resources and created SuffolkStopBullying.org. And I highly recommend parents, teachers, students go to that website. There are so many wonderful resources. What we did to promote it, we had a bullying awareness video contest, and we had some students win that contest. We had Mike Del Judas from Big Shot. He plays with Billy Joel. And he presented them with an award, and it went very well. You know, again, we just need to get the word out there. And also the message from that bullying awareness advocacy is that students need to be an upstander and not a bystander. They need to engage themselves when they see something is going wrong, because you want to treat people the way you would want to be treated. So this is a way of doing that. And again, we're trying to promote the idea of being an upstander.
Okay, and just for those who perhaps didn't see the show, because you were on here last year, an upstander is someone who comes to, when they see somebody is being bullied, they come to their aid and assist instead of just standing passively by and just observing.
Right.
Okay.
And also, New York State created the Dignity Act, and they have a DAC, a Dignity Act coordinator, and that's the person, the to-go person at every school that if you feel you're being bullied or if there's issues, you go to that person, and we have on the website information pertaining to the school district and that person that you can reach out to.
Okay, wonderful. Okay, well, I'm happy to have you here to discuss your efforts in Suffolk County and some recent legislation, and you also have established an advisory panel, so we're here to discuss these issues today. First, let's discuss some substance abuse issues. In April of 2014, you established an advisory panel to address the lack of long-term substance abuse treatment facilities available in Suffolk County. And the panel was created to assess the inadequacy of facilities and services for substance abuse rehabilitation. Would you like to discuss that for a moment?
Sure. So basically what's happening with the drug abuse situation is that our children are becoming addicted intensively in this area throughout the country. And what happens with opiates and heroin, it takes a longer time to go through rehabilitation. And what happens, again, with the insurance companies, the hospitals, they limit the ability to recover from addiction. So what I've done is, I created the panel. We looked at different locations. We're focusing on the John J. Foley Center, which recently has been agreed to be purchased by Brookhaven Hospital. Yes. And they have agreed to place a rehabilitation center at that location, in addition to other services that they'll have available. So again, that's one resource, but we need more places where our residents can go to recover for long-term rehabilitation. And I'm working with Hope House, Father Frank, and other organizations to find these locations.
And that was going to be one of my questions, by pulling together key stakeholders within the community. I'm trying to raise this awareness and see about getting the assistance that we need, and seeing if, as I was going to ask you about the Foley nursing facility.
Sure.
So I'm glad to know that they've agreed to do that.
Right.
For substance abuse and mental health.
And mental health, addiction goes hand in hand with mental health. They're co-occurring illnesses, and we need to address that. Both the mental illness for, whether it's drug addiction, we have the post-traumatic stress disorder from our veterans coming back. We have dementia, Alzheimer's from our senior community. We need to address that, and government, at least at the federal level, they're not doing their job. I'm telling you, we need to do more on a county level. I'm doing everything I can, but again, we need to work with the other levels of government and focus them and prioritize the lacking issue of help and assistance with this.
Now, is this panel still in existence and looking at?
No. At this point, we're focusing on other issues. When you talk about drug addiction, there's education. So I worked with the local school District and the county executive to create a public service announcement about drug addiction, and we interviewed a mother who'd lost her son. This stuff is serious. These kids don't realize that opiates and heroin and the drugs out there can literally take away their minds and permanently create illness, mental illness, for the rest of their life.
Yes. Okay.
So again, we're going to focus on again, education, enforcement, rehabilitation. Those are very important components with the drug addiction issue.
Okay, thank you. We will be right back with Legislator Sarah Anker from Suffolk County after these messages.
Hello everyone, I'm Corinne Murphy-Caro, and I'm the founder of TheDailyBlue.com. The Daily Blue is all about spreading positive news about Long Islanders, and we want to hear from you. Tell us your stories. Our show hosts are waiting to hear from you. Sponsor an ad or advertise with us. Call us now, 631-761-9223.
Back with Legislator Sarah Anker. Welcome again. Thank you for being here. And now we're going to discuss liquid nicotine. For those viewers who do not know what liquid nicotine is, it is called liquid nicotine, or it can be called e-liquid. It's a nicotine-containing product that is in small plastic bottles that is used to refill electronic cigarettes or e-cigarettes. Some of the e-liquid comes in sweet flavors, which can be appealing to children, and the flavors can be apple candy, brown sugar, butterscotch, chocolate. Nicotine is highly addictive. Poisonings have resulted among users and non-users due to ingestion of nicotine liquid, absorption through the skin, and through inhalation of the product. Just a teaspoon of even highly diluted e-liquid can kill a small child. This information is provided by the Centers of Disease Control and Prevention. So Sarah, you have had legislation that you sponsored and was passed and signed into law, and it required retailers to post warning signs about the dangers of e-liquid, of liquid nicotine. Would you like to discuss that, please?
Sure. So when I found out that there was a product out there that was not being regulated by the federal government, and I have to say the Food and Drug Administration, they are not doing their job. They're the federal level, and they should be protecting our residents, especially our children. So basically, they're allowing this toxic product to be released into our country, and our kids are using liquid nicotine as a recreational drug. You mentioned the different flavors: gummy bear, cotton candy, the very sweet flavors. Would an adult really want to use gummy bear liquid nicotine? No, it's being marketed to children. And the scary part is that the labeling on these little vials of liquid nicotine are being created by someone putting this stuff together in the basement of their home on a computer label. They're not putting the ingredients, they're not putting the amount of liquid nicotine. They did a study and they found quite a bit of formaldehyde in the liquid nicotine product. And that's a carcinogen, a cancer-causing chemical. Our children are being exposed to this, and they're using this stuff, and they don't think it's a big deal. So I tried to get a warning label on the liquid nicotine vials, and that's what they are, these little vials, with the crossbone, and really make people, especially our children, aware that this stuff is toxic. But I was not able to, because I don't have the jurisdiction, according to my legal department. So what I moved forward with was creating a warning sign. Every retailer that sells liquid nicotine now has to display this warning sign, at their stores. So, again, ingestion of liquid nicotine may be fatal. A 5-year-old boy died after ingesting, and you can actually be, have a reaction, and you could probably be killed if you drop some on your skin. That's how concentrated this product is. So, a lot of the product itself comes from China. And big vials and big jugs, whatever, that they bring over, and they mix it in, again, in these, it's like a black marketed type of place, and then they sell it, at different, 7-Elevens and smoke shops. And liquid nicotine was supposedly created to reduce your cigarette habit, but what's happening is they're getting these young kids, 12, 13, 14, hooked on nicotine, so later on they probably will start smoking. It's really concerning. And not only is there liquid nicotine, there's powdered caffeine now. And Legislator Spencer has created legislation to help with that, get that away from our kids. A lot of people didn't know that this product, nicotine, you cannot sell it to children 21 and under. And that law was created when Legislator John Cooper was in office about 6-7 years ago. So, if you're a retailer out there, it's illegal to sell this product to children. And moms and dads, if you see liquid nicotine in your kids' rooms, it's illegal for them to have it. So, please be aware that this product is not meant for children. There's also another product now, there's caffeinated water. It looks in little water bottles, and it has in small print caffeine. There's caffeinated peanut butter. These are marketed to children. Yes. So it's very concerning that the FDA, they're not regulating these products.
Hopefully they'll start looking into these, a little bit faster than they've been moving. This sign, where should it be posted in a store that does sell this product?
Near the point of purchase. So, the lobbyists, they were calling me and the legislators, no, we don't need this, we'll do it ourselves. No, this is why we need laws. We need laws because big money is dictating the health of our children, and that's not right. Our health of our kids it's priority. So, again, I'm hoping that, we can get the word out that liquid nicotine is not meant for children. Moms and dads, if you see them with this product, please discourage them or just take it away from them.
This sign can be downloaded from the Suffolk County Department of Health website. And for those of you who can't read all of the fine print on here, it does say that there are signs that you can look for, which would be increased heart rate and increased blood pressure, dizziness and nausea, can aggravate respiratory conditions. It's not recommended for women who are pregnant or breastfeeding, or for those who are at risk for heart disease, high blood pressure, and diabetes, or those taking medication for depression or asthma. Those people should not be taking this product.
Right.
Okay, and we will be right back with Legislator Sarah Anker after these messages.
Hi, I'm Tim Stead. I'm from Star Communications. We're a marketing support company. And if you need help with your next marketing project, please call 273-1900, or you can go to our website, starcommunications.us.
And we're back with Legislator Sarah Anker, and now we're going to discuss sports safety in our youth. In light of some recent sports incidents, can you tell our viewers if there was a specific incident or moment that made you realize that our children needed more protection, and what that was?
Right, absolutely. So what has happened in Shoreham, a high school football player was killed or died actually due to a concussion. And also in a Shoreham resident, North Shore Little League, a boy was hit in the chest with a ball, died, but was revived using a defibrillator. And again, if it wasn't for the Rocky Point Fire Department donating the defibrillator, and an police officer who was a coach, who knew how to administer the defibrillator and use it, the boy may not have survived. So with all this and understanding too that there's a lot of the sports not-for-profits, they don't require safety programs. So, and that's concerning. And there's a lot of issues that I think of. We need to do this in a better format. And so what I did was create the school sports safety forum, and this basically brought together experts in the school sports field, working with the Shoreham school district. And we had Section 11 director, Don Webster, working with the athletic director from Shoreham, bringing together a physical therapist, and we had Rydell football helmets. We saw how the helmets were created, and it was a great discussion. We videotaped it. It is available. We're going to see if the school districts throughout Suffolk County will put it on their websites. But it showed an understanding of how you can prevent sports injuries, because once you have a sports injury, it stays with you forever. Yes. Some people as they get it when they're younger, as you get older, the weather is affecting my knee or my hip, or it's an old sports injury. We need to make sure that we protect our children when they're playing sports. and that's what the discussion was about. So I will get that information over to
Okay,
you.
that'd be wonderful.
And again, we just want to put the word out there that there are safety precautions that you can take. Another very important part to the Sports Safety Forum is that as a volunteer coach, and I was a volunteer coach for my daughter's soccer team when she was 5 and 6 years old, and I wasn't given safety instructions.
Right.
I have kids with severe food allergies. I know how to use the EpiPens and also the inhaler with the asthma, but there's a lot of people that don't know about that and don't understand that volunteer for these nonprofit sports teams that are
Right.
so much appreciated. They give a place for our kids to go and feel good, and so I think we need to do more and provide that information to the sports leagues so they can disperse it through their organization. One really important component, though, of this forum was that I wanted the message to the coaches that they are the mentors of our children. The kids look up to the coaches. They
Yes.
listen, even sometimes more so than their parents. And if the coaches can talk to the kids about, drug awareness and, even like liquid nicotine, energy drinks.
Right.
Oh my goodness, these kids think these products are so cool, and they're not.
No.
They create health issues, and we need to be aware and try to get the word out that our kids are the most important parts of our lives, and if we can protect them, we need to do that. And when they're away from us, and say, the sports people are, sports folks have them in their, in their realm, they have the ability to be their mentors. And
Well, they're role models for the children, and so they can show them how to play safe and to be
Exactly.
safe when they're out there, how to properly wear the protective gear that is needed for whatever the sport is that they're playing.
Yeah, and we have the technology now. We really do to monitor how our kids are dealing with sports injuries.
So basically, it's education to protect the children, to try to keep them injury-free, and to focus on injury prevention and keep them healthier, so that they can have a healthier life in the long run. And you gathered local resources for this, and you gathered informative material to help educate parents and the coaches about best practices.
Absolutely.
And so then you have this, you said, in a video format. So if people are interested, they can contact your legislative office, which is 631-854-1600. But you'll also provide us with a website where this video is available.
Absolutely, and I think an important part of this is that this was the beginning that we've started with sports safety. What I hear is that because this worked out so well, and the information that was produced, Section 11, Suffolk County, they're now taking it to the state level. And then again, Section 11 oversees all sports safety throughout all schools, in the state. So this is really exciting.
That is wonderful. That is great to be able to get all of the stakeholders in the community, the parents, the coaches, experts in the area together, and to get all of that information. For those that may be interested, I did a show on children's youth concussions, so that can be also viewed Your Health Matters on the Daily Blue site. And again, Legislator Anker, I thank you for being out in front on these issues. They're important issues that affect the public health of both children and adults, and so I thank you so much for being on the show today.
Well, thank you for having me.
Thanks.
Looking forward to coming back again.
Yes, I do. I look forward to having you back. And that concludes our show for today. Again, I want to thank my guest, Legislator Sarah Anker from Suffolk County, the 6th District, for visiting with me on the set today and discussing these very important topics about substance abuse, liquid nicotine, and youth sports safety. Please join me next week when my guest will be Dr. Stephen Shore, Assistant Professor of Education and internationally known expert and leading educator on autism from Adelphi University. We will discuss his book, College for Students with Disabilities, We Do Belong, a realistic discussion about college students with disabilities. Have a safe and healthy day. Thank you.